In this video, we're going to talk about reducing hand support as part of training with the sit-to-stand trainer. The basic squat is done with both hands on the handles, and there's going to be a certain amount of pulling with the arms anytime that the patient has their hands on the handles. If we want to work towards building an independent stand, we gradually want to reduce the reliance on hand support for completing the movement, and eventually do the movement entirely with the lower extremities to be able to do an independent stand. So progression toward doing this may involve using a counterweight. So again, for a patient that's able to stand with hand support and not require any weight assistance, bridging that skill into doing the same thing without hands may require the addition of some counterweight. So again, the sit-to-stand allows you to create that supportive environment where a patient can attempt that new task and be successful at it. So in this case, I'm going to add some weight support. And where I'm unable to stand without hands, without some support, the weight support may allow me to actually get up off the chair without that support. And I can continue to practice this, and gradually through a number of repetitions, and again, volume of repetitions may be our goal here, to practice that movement and practice the timing aspects of it, I can start to learn the skill of getting up without relying on my hands. Now, there are a number of ways we can approach this. The first aspect is putting on counterweight. We may not go to complete hands off immediately. We may start with having one hand on and placing another hand on the chair arm and standing up in this configuration. Can also be approached by standing up using the hands and then introducing sitting down with no hand support. So we'll use the hands to come up, and then practice sitting down without hand support as well. So again, the counterweight can be key to that. So by placing that 20 pounds, I'm offsetting my weight just enough to slow the movement down to give me a chance to actively participate in that move going up or going down. So the key features as well in terms of cueing for patients that are attempting to work without the hands is going to be leaning the upper body forward, so getting the chest and trunk forward far enough to create the right conditions where an independent stand without using the hands can happen. So progression of this skill would be in the number of repetitions that patients are able to complete without hands, and gradually reducing the amount of counterweight. So if I'm able to stand with no hands with 20 pounds offsetting my weight, eventually I'll want to reduce that to 10 pounds and gradually attempt to do the same stand with no weight assist.